Well, good evening, everyone. It's really a treat for me to be here. Glenn, I want to thank you so much for that extremely generous introduction. But honestly, your wife labored more than you did. Now that we've settled that score, we can come back to business. It's just a thrill for me to see this group gathered here and working in concert to learn from one another about public health services and systems research, how to be even more effective in the enterprise, because the more effective that we are in learning about what is being accomplished and what is needing to be accomplished through public health, the more effective ultimately public health can be in meeting the real needs of people everywhere in our country. And ultimately, I feel that we just have to keep in mind that end goal, which is the health of every individual in our country. The only pathway to a healthy community is healthy individuals, and the only way we have every individual healthy is when we also have healthy communities. Now, I know that you already spent a lot of time today hearing discussion about recent work at the Institute of Medicine related to public health. And I also know that you've got here in the audience folks like Martha, Lloyd, others who presented earlier today and described that work. It makes me feel a little bit like the chauffeur in the story of the Senate candidate in the Midwest who was driving around from Grange Hall to Grange Hall giving the same stump speech while he was trying to get the nomination for his party. And it got so exhausting for him. He finally got to one hall at the end of the day, and he turned to his chauffeur and he said, "You've heard me give this talk 50 times. Do you mind?" And he handed the chauffeur the paper. He said, I'm beat. I'll sit in the back and you give the talk. So the chauffeur said, okay, but let's switch jackets. So they switched jackets, and the candidate took the hat and he sat in the back of the room. The chauffeur went up to the podium and he started to deliver the speech. And the candidate started to perk up because the chauffeur had exactly the right cadence, the right pauses, the right laugh lines, the right points of emphasis. He ended on a dramatic high. There was wild applause, and the questions began. And the first question, they'd heard a dozen times. The chauffeur answered that right off the bat. Second question came up, and finally someone raised a question about the United States foreign policy at the time that we were leaving Lebanon. Well, this had never come up. So the chauffeur, without missing a beat, looks at the questioner and says, that is so elementary that my chauffeur will answer that question. So just in case you have any questions about the work at the Institute of Medicine, we've got some real experts here in the audience who will be able to handle them. When I started at the Institute of Medicine now about 10 years ago, as Glenn was describing, I called in the senior staff to get acquainted, and at the end I called aside the person who was a deputy executive officer, and I said to him, what would really help me is if you could go back and talk to all of the board directors and bring me examples of the best work we've done, because I think I can learn from the best that we've done. So he left the room, and I was making some notes and working away, and about a half hour later, there's a knock at the door, and he's back. And I'm thinking, boy, that was fast. And it wasn't to give me the answer. He said, I have a question about the assignment. And I said, well, what's the question? He said, what exactly do you mean by best? So I said, well, what do you mean by best? And he said, well, When you say best, do you mean the study that has the soundest base of evidence, that is the most exquisitely argued, that has conclusions that follow from the line of logic, that is clearly written and is expressed exactly with precise language? Or do you mean the study that had the greatest effect on decision-making and the world? So I said, well, I guess I meant both. Sure enough, within a couple of days, I had 2 lists of studies. And I'm very pleased to report there was some overlap. However, I learned a very important lesson from that little exercise, which is, if you want to have effect, it's not only by doing excellent work. It's not enough. And the lesson that I tried then to convey from then on to our staff is that the reason to make every study as good as you can, as correctly argued, as grounded in evidence, as thoroughly reasoned, and as clear as you can make it, is not because that guarantees it will have an effect. It's because, just in case it does have an effect, you want it to have been right. Now